Thus, in a society where social, cultural, and religious beliefs are barriers to sexual and reproductive health, the state government is keen on improving this aspect of human life through awareness and adequate access to sexual and reproductive health products. It believes this will help women and girls freely control their own bodies with modern contraceptives. Zainab Akonde has more on this.
No, I will come back.
In Nigeria, conversations around sexual and reproductive health remains a topic people are not comfortable talking about. Youth are not left out as they shy away from these discussions because of the stigma they might face for sharing their thoughts. Myths and misconceptions about contraceptives and other sexual reproductive products is an eye-opener to intensify efforts in raising awareness.
Contraceptive especially for women, to prevent pregnancy or to control childbirth. To my own belief, I think maybe the Western world want the Africans to reduce the population of Africans. Maybe that's why such thing is being introduced.
But some people are comfortable to talk about their knowledge of sexual and reproductive health and how it has impacted their lives positively.
Family planning is very good. It protects a woman from getting pregnant against her will.
You can say the economy. The economy will teach you that you should do what? You should be careful. It is advisable to whether family planning or contraceptive, whichever way that is good for you. But you have to seek advice from the expert.
According to a report by the National Demographic Health Survey, the use of modern contraceptives among 15 to 49-year-old married women is about 12% compared to a global average of 54%. This survey explains the low demand for sexual and reproductive health products among women in Nigeria.
We are surrounded by people who have sexual and reproductive health organs and they're not taken care of, and this leads to the untimely death of a lot of women and children across the country. And a lot of these deaths are very preventable with the use of different interventions.
Cultural norms and religious beliefs has been identified as a barrier that affects the awareness of sexual and reproductive health.
People still have thinking, and that you taking up a contraceptive method, you have some some issue with with fertility. No, they are just giving you a chance to decide when you can have kids and how many kids you can afford to take care of.
The Lagos state government says it is committed to more awareness about sexual health and inclusivity among women with disabilities.
When it's time to go out and do screenings and do community awareness programs, we also want to go to where we have them having their meetings, so we go into where they are to ensure that we bring information to them. More importantly, we've also trained our health workers on how to respond to special groups, people living with disabilities, the young persons, the adolescents who have special requirements, on how to ensure that they get access to care when they walk into any of the facilities.
We researched and discovered that part of the major bottleneck was the logistics support to take all these commodities from the local government store to the various service centers. So what the government approved is the last mile distribution, which is what we do now. And what that entails is we get a third-party logistician to take the commodities right from, the state medical store.
They believe this awareness is the first line of action in ensuring a safe space where people can express themselves freely and use sexual and reproductive products with no shame. Zainab Akonde, TVC News, Lagos.